Hello and welcome. My name is Chris from ChristopherHole.com and welcome to today's podcast where we're going to be talking again to Dr. Stuart McGill about his new book, Gift of Injury. It's available at backfitpro.com, and that's for anyone, whether you're in the USA, Europe, Australia, or the UK. You can just find your flag on the site, click it, and you'll be able to find your cheapest postage and purchase site. So, without further ado, we will get into the podcast. We're going to sort of work our way through parts of the book. Obviously, we won't be giving huge amounts of the content of the book away, partly due to it being a podcast, but also we want the book to be distributed to as many people as possible because there is some really valuable content. I've had the chance to read through it. It's a phenomenal book. It's for a particular population, but I think a lot of the principles in the book still do relate across different sports and different populations as well. So without further ado, let's get Stuart talking and getting into the crux of the content in the Gift of Injury. Before we get into that, Stuart, can you just introduce the book and sort of describe what the Gift of Injury is about, and also what kind of made you decide to write the book? It sort of comes from a slightly different perspective of your other books. So how did that all come about?
Yes, it is a bit of a different book, and it wasn't something I anticipated. It grew very organically. In the beginning, I ended up seeing Brian Carroll, who, if people are in the strength or powerlifting world, would know that name as a record holder in two, or I think it was three different weight categories at different times. And he came to see me as a back pain patient. And it was funny. I didn't realize the dark place he had come from, and how, well, as it describes in the book, he had been given these prognoses from a neurosurgeon and an orthopedic surgeon, and he was considering taking his own life at this point with no way out. But somehow he ended up flying up to Canada, and I said to him, well, I don't know if I can get you out of pain. I will try, but here's my suggestions. And he said, but I also want the next world record. And I said, well, if you were my son, I would advise you against that. But how about this for a deal? Try and execute what we have recommended here. And then if we are successful in getting you out of pain, I'll need you to come back and bring your wife, and with my wife, the four of us will go out to dinner and we'll discuss whether you really want to risk it all and go for the next record. Well, as you know, that's exactly what happened, and he did come back and win once again. So the Gift of Injury was really as many record-sending athletes have found out when they've come here. They'll tell you, we didn't set a record until after our back injury. And the back injury taught us to pay more attention to the science of injury mechanics and the science of training. And that was the gift, to incorporate science to extend their capacity, or the tipping point. And when you cross the tipping point, you get hurt. When you're underneath the tipping point, it's very anabolic. You build your body. So it's a science to know where the tipping point is and then extend it as much as you can, and then use science just to stay under it. Train well, and don't cross it. So that's my first answer to where that all came about. But as we started to kick around this idea of writing a book, and I flew down to Florida and spent quite a number of days with Brian discussing how we would shape the message on this. As you said, it's a different book for me. And then it did start out as Brian's story and the science of bone callousing, and because people don't realize he had a horrific injury. He'd split his sacrum front to back. He'd crushed L5, the vertebra, and the discs above and below were very badly damaged. So in telling his story and then the science of getting his rehab organized and his training done once again, we'd never told the story before from the personal perspective. And people thought, oh, well, they've heard about McGill's work and they read in a popular magazine. And the magazines always want a sound bite, and they usually go for the big three. And here's the magical 3 exercises to get out of pain. And that's not it at all, as you know. It's about understanding what the mechanism of pain in that person and specifically addressing it. So it was really the first time that people started to realize that we went far beyond just getting people out of pain and finishing off the final objective of getting them back to doing what they love to do, and whether that was just playing recreational sport themselves, or it was going for the world record in or getting a gold at the Olympics or whatever it happened to be.
And in the book, you sort of obviously talk very specifically around Brian's injury. Is it written with like powerlifting and strength athletes in mind, or can other sports people read the book, to some degree understand the principles within it and maybe follow those principles, and not necessarily some of the actual specifics that you do talk about? Because obviously when you talk, there's a lot of you talking and then Brian talking, and then you sort of mash the two together to be able to in a sense sort of bring out the result of the exercises to do and this and that and the other. But is it useful for other sports people, be it American footballers or soccer players or rugby players or whoever it may be?
Well, I think you hit the nail on the head when you used the terms principles and then specifics. So the principles are ruled by science. They're universal. That's biology and psychology and all the rest of it. So yes, the principles are broadly applicable, those being you have to have an assessment that reveals the causal mechanism of the pains and loss in performance and all that kind of thing. But then how that is addressed, there are principles within each category, but there are also specifics to sport. Let's take an example of a tennis player or a basketball player. They both, in terms of a principle, require core stability and hip mobility. But then we get into the specifics of that. So we would build the core, which would then allow them to unleash their hips and then start working on footwork. And in both of those sports, one of the primary footwork mechanics would be what's called the drop step. So if you're standing square, you would lift the right leg off the ground, turn it outwards, and take a step back. So you can imagine boxing out an opponent in basketball, rebounding under the basket, or you could imagine a forehand in tennis where you would drop step, turn the body, swing the racket with sufficient core stiffness, shoulder and hip mobility to really put some speed on the ball. If they were doing a backhand shot, they drop step with the left. So there's an example where we would take a primary athleticism like that in terms of a principle and drill it with specifics, but both required a foundation. because that person was coming out of a weakness and a pain history, we had to address that first. Building their core, giving them the appropriate mobility, and then add in the skill of speedy footwork. So that's my answer. Yeah, the principles are universal, but the specifics are obviously sport specific. So that means you have to know something about the sport. And obviously this book was biased towards the strength athlete. My other book, Ultimate Back Fitness and Performance, would have a broader spectrum of sport endeavors.
And you sort of talk through, obviously the beginning of the book is a lot about Brian's story, which is him growing through the powerlifting ranks, if you will, and working up through. And then he sort of talks about the demise of his back, and you get to chapter 4, which the image of his spine absolutely fascinates me. With the one with the disc bulge, the crushed vertebrae at L5, the bone edema, and the massive sacrum fracture. I guess a couple of questions on this is, I think I know the answer to this one, but first, was he lifting with all of that injury? And then, how does one, as an athlete, get to that point where their back is in that much trouble, or in that much disarray, or destruction's happened there? Is it a case of it just happens slowly over time, or was there a big event that happened? What kind of goes on? I would imagine it's more to do with the specific of Brian being who he was and what he was doing. But how does that sort of injury and image come about?
Yeah, I can't give you an answer and state for sure what the mechanism was, because truly no one knows. And, you know, I get asked as an expert witness in legal cases, can I come in and say this alleged event or negligence of a person or a product led to this specific tissue damage? All I can say to the court, for example, is this is the mechanism for compression damage, and this is the compression damage or shear damage or bending damage or whatever it happens to be. So the split vertebra is a compressive injury. Basically, when you look at all of those, they were compression primarily, and then bending stresses on top of the compressive damage really compounded. So that's what the biology would show us in all of those injuries. But in Brian's specific case, he says he slipped and fell and pile drived his back running an obstacle course a number of years ago. And he said that was really the beginning of the pain. So we don't know exactly what went on at that time. There was no imaging to show, or he had no assessment. But there's no question that as he continued to lift, the tissue deterioration continued. But here's the amazing thing about the body. If you understand tissue adaptation and stability and how stiffness holds all these body parts together, you can get away with tremendous losses in structure. You know, you see some people who are completely ACL deficient. They've lost the cruciate ligament of their knee, and you wouldn't know it because of the muscular stiffness that they've been able to create with the appropriate pattern. Well, successful people do the same things with their back and organizing how they activate all of their muscles and that kind of thing. So power lifters, they even enhance their inherent muscular stiffness by wearing tight suits and weight belts and these various pieces of gear. That's all part of this stability rubric and stiffness rubric that we're talking about. But anyway, that damage did accumulate, and it got to the point where he was in continual pain all the time. And when he came to see me the first time, here was a man who had squatted well over 1,000 pounds, but had difficulty reaching forward and picking up a piece of paper.
And that's probably one of the most fascinating things, is the fact that he was able to carry on for so long lifting with a back like that. And do you mind just talking about, there's a small little section in the book about bone callousing, I think it's called, and how that mechanism works, because there is as you mentioned, there's a degree of value in the breaking down of a tissue as long as it's able to recover and come back stronger. Now we know that with muscles, but as the book mentions, if I've got this right, that the same thing's happening with bone and with vertebrae with regards to building stronger joints, I would imagine.
Yes. Well, I could take that answer in several directions, but let me just answer bone callousing, and then I'm going to talk about sclerotic bone, simply for powerlifters. But bone callousing is this. If you take a long bone, say your forearm bone, and if you were to bend the bone, the outside of the bend goes into tension, and the inside of the bend goes into compression at the bone level itself. So say you were to fracture that, you would build a callus of bone over the fracture, and that would be even stronger than the original, what we would call or refer to as virgin bone. So that's an example of bone callousing in long bone. And the mechanism is this. Bone is a piezoelectric crystal. It behaves like certain crystals and metals, actually. When you stress a bone, it builds up an electric charge at the site of greatest stress. The free-floating ions of magnesium and calcium, in other words, the basic elements that form bone, and some of them are metals, they are charged. And when you build a piezoelectric charge on a bone with stress, it sucks in more of those charged ions and lays them down. And there's a matrix that gets built up, or a scaffolding and more matrix of bone. So that's how bone has this intelligence, or knows where to lay down bone. So that's an explanation of bone callousing and how it works in long bone. But vertebra are different. They're blocks of bone. And I've done it a couple of times with other athletes. And I said to Brian, well, first of all, we'll get you out of pain, which we did do. And then I said, if you really want the next world record, I'd advise you not to. My advice is just enjoy a pain-free, happy life now. Why take the risk of really major damage? It's something that you could never recover from. But he said, no, let's do it. And I said, well, here's what I know about callousing vertebra, but you'll be the third or the fourth athlete. It's an experiment in progress with no guarantees. But he was committed enough to it. So what you do is you give a little bit of load stimulus to the bone, and then you give 2 or 3 or maybe even 4 days off of load. So that creates the charge, lays down more calcium, magnesium, and the building elements of bone, and it allows it to stick and calcify in, if I could use that term. And then you repeat that, another 4-day cycle, another 4-day cycle. I would like to do it for a year and really build that foundation. But Brian sped it up. I think after several months, he then started to add training. And it was successful. And the before and after MRI images, I mean, the first one, you describe it, it was a horrific injury. sacrum is split apart. And yet, 2 years later, the bone callousing had filled in all of the split, and L5 was built back again. So it's a testament to how a proper loading allows a tissue to remodel and build back to somewhat of its original form. In that same chapter of the book, I also show micro CTs of vertebra, and then it allows me to tell the story of why some people hurt their backs deadlifting and then never recover. And the reason is this: if the average power lifter or strength athlete, say a rugby player who's trained a few years, went and had a CT scan of their spine, the report would probably come back and say you have sclerotic end plates, which means very heavy, glowing end plates. And that's an adaptation, because strength athletes create very small microfractures in the scaffolding of bone just underneath the end plates, which are the top and bottom of the vertebra, when they train heavy. So the trick is they do create those microfractures, but they use training cycles. They don't overtrain. They'll take load, and they might, say, go through a 2 or 3 week training cycle, and then they have a 1 week deload cycle. It's the people who think more is better. They continue to train day in and day out, and I'll say to them, when was the last time you had a day off? And they look at me as if I'm from Mars. And they're not training scientifically. The bone adaptation takes place when you rest, not when you continue to load it. So the microfracturing in the vertebra actually grows and grows and grows. And sooner or later, the rate of repair is outstripped by the cumulative fracturing that takes place. And then they start getting a disc bulge, because the fibers that form the rings of the disc start to dislodge off the they're called Sharpie's fibers that go into the bone, but the bone's breaking underneath. So now this allows the delamination of the fibers in the annulus to proceed. So it's a house of cards. But of course, great strength athletes have built the sclerotic bone very cleverly. In other words, they've calloused their own spines. It's the people who violate this scientific principle and just train, not allowing proper adaptation, and then they get into real trouble as the collagen fibers start to rip off the bone, and they end up getting disc bulges, and they don't know how to train their way out of it. But it is training cycles that we describe in the book, of course. But I hope that gives a general overview of the whole adaptation process and how to make it work for you. You have to follow biology and science. It's just the way it is.
What were some of those conditions that you were talking about with Brian to allow him to lift through all this rehabilitation process in order for him to come back stronger, fitter, faster?
Yes, well, really, he didn't lift in the beginning. It's a matter, just as you described with your footballer, you built the foundation for pain-free movement later, and that's what we did. So when you rehabilitate an athlete, when I study why athletes fail to recover, and those are the ones I get. I mean, I only get the ones who've got back troubles and they've failed other approaches. So I'm sort of the last hope for many of them. But it's a two-stage process. Number one, we perform an assessment very thorough assessment so we really understand the mechanism of their pain, and then we get rid of that. So in Brian's case, of course, it was heavy load and poor movement form. See, pain is a terrible corrupter of movement patterns. Here was someone who had excellent lifting form. He'd squatted well over 1,000 pounds. I forget what his deadlift was, but it was ungodly. It was the best in the world in that weight division. But when you get pain, you know, if you have a pain in your foot, you limp. Well, if you're a lifter and you've got back pain, you do strange things all day long with this corruption of the pain. So it was a matter of repatterning his daily movements just to take the load off so he could create a training capacity. You know, he'd just throw himself onto the floor and do some exercises thinking that would assist. And again, it wasn't his fault. He was disgusted with himself, not understanding why he is in so much pain. And again, this was before the assessment to really understand what the mechanism was. But to focus the answer, it's stage one: get rid of the cause and move in a way that doesn't cause pain. This allows neurologically a desensitization of the whole pain process. So what was triggering pain a month ago is no longer triggering pain. Neurally, they've raised that trigger level, so to speak. We don't talk about performance training in that first stage. It's all about desensitizing the system, taking the offending loads away, etc. Then when they're out of pain, we shift into the second stage, which is now, what does that athlete need for the foundation of whatever their athletic performance is? Obviously, the book was focused on load bearing and the strength athlete. We would do a different one if I was to do a UK Premier League footballer, for example. But anyway, that's so lifting. That didn't really come in until stage two. But that very much was building a core of iron, unleashing his hips, but not too much mobility in the hips. A power lifter has what we call tuned mobility. In other words, we want them to work a little bit to get right down into the lifter's wedge, so that tight passive tissues are allowing and assisting the upward thrust of the movement together with muscle. We don't want to stretch them out, so to speak. And I think too many trainers do too much mobility on certain athletes. Or if we had a jumper or a high jumper or someone like that, we try and keep the hamstrings as tight as possible, which again would sound very odd to some people. But those are just examples of how we would tune in that stage two.
And as we, I guess, move on into the book a little further, you start going into the actual programming part, and we start seeing some of the exercises that you've asked, some of the mobility drills that you've asked Brian to go through various images and so on and so forth. And now you've mentioned some of the the stages with regards to reducing the pain and then building the core. What kind of I guess exercises might be included in that, and why might they be used? Because you talk about core stiffness and control, core endurance, and sufficient mobility. So what kind of exercises are going to be building those elements of someone's fitness and of someone's body?
Right. Well, we get out a pencil and paper and we write down, what does this person need as a foundation to perform? And in Brian's case, not only did we need more core stiffness, but we also needed drills to regroove some of those movement patterns back once again. So obviously, to start off core stiffness, there's nothing better than the big three exercises, which is the bird dog, the side plank, and the modified curl up. Or we can move very quickly to various forms of the front plank. And people think, well, what's a big power lifter doing a bird dog exercise? As an example. Well, we've trialed this several different times. I'll give you one example of a study I did with Ben Lee, with Muay Thai fighters and then non-fighters as sort of the control group, I guess. And we would train them doing the big three, and it adds core stiffness that stays a little bit longer. So if you were performing a hand strike or a punch, in other words, or a leg strike, a kick, if you can stiffen the core, the power that is developed about the hip drives the leg with a higher velocity and more power than if the spine was allowed to bend, which would be an energy leak in that particular case. So we found that the fighters were striking harder when they had more core stiffness to propel the leg, as an example. Kicking a football or a soccer ball is exactly the same thing. When you measure the great ones, they hardly look as though they're trying very hard at all. But what they do is they unleash the leg. It swings through like a pendulum. But when the foot hits the ball, they have core stiffness, which really adds more power into the ball, and the ball just flies through the air. They make it look so easy, but it is with the core stiffness. So getting back to Brian, that foundation was non-negotiable. And then we had movement drills to drill in hip mobility so that he could utilize the newfound core stiffness. And then the real trick to strength is what I'll refer to as neural drive. So muscles contract, obviously, because of nerve impulses, but let's follow that whole mechanism. The foundation of strength is really the mind, and the mind is where the origination of the nerve impulses come from. So they're formed in the motor cortex. Well, there are tricks to create very dense neural drive, strength of thought, etc. You have to be in an emotional state. You want to be borderline fight or flight. All of these things. And then you send out as dense a strength thought as you can. Well, the next part is more anatomical. You've got to get the nerves to carry as much electricity, to be gross about it, or to carry as many nerve impulses as you possibly can. And there we would use grinding exercises. A bench press, for example, is an ideal grinding exercise because it's with proper form, you can adapt it so it's not very hard on the back when a person is in that early stage of performance training. But they work the sticking point. They learn how to think more strength, carry and grind through the sticking point, and using tricks like spread the bar, squeeze the bar, bend the bar. Create small pulses in the legs, and through core stiffness allow that to propagate through, to pulse through the sticking points. Anyway, there's just a little bit of an essay on densifying neural drive. So that was all part of Brian's program as well. And of course, he knew all these things as the former champ. We just needed to overcome the corruption that had taken place in his thought patterns and neurology to really regain that strength once again. You know, Chris, if I can just mention this, what the Gift of Injury book does, and I can't remember the chapter, but after we've taken the person through the assessment, that's in section 3, I think it is, or is it section 2 is where we give the cues and the process of assessing the athlete or the client. The next section gives a bit of a process on how to program. And it starts with know what it is you're programming for. So if you want to be a power lifter, here are the things that you need to be a power lifter. If you want to be an MMA athlete, here are the things you need. If you just want to be a good mom or dad and play some pickup sport with your kids on the weekend, here are the things that you need. Anyway, you write down in column 1 all of those things that you need. And then in column 2, you write down the things that you currently have. So you assess those variables that you need. Does your body have them? And if you don't have them, the highest priority is to develop the things that you will need. And then the third column, you start writing down the exercise tools. What exercises give you the best risk reward for getting your body to achieve that particular goal that you've written down? So with those 3 columns, that now starts to form the content of the program. So we show people how to do it. And then we have little discussions on programming cycles and whatnot after that. And Brian, of course, being the repository of strength training, I mean, it was all in him. He certainly chimes in with how he created world-class strength.
Talk us through some of the coaching cues that you might use in order to set an athlete up for the bench press in a spine sparing or back sparing way.
Well, you've got me stuck now, because I was able to do that until you said in a spine sparing way. Right. And that changes my answer now, because as soon as we talk about pain, my answer always must begin, well, it depends on the person. What did the assessment reveal was their specific pain trigger? We have to respect that pain trigger, and then we will know how to coach the bench press. I'll tell you a fun little story. Most people know I've retired from the university now, but when I was a professor, I would say to students, do you know how to do a bench press? And of course, every student would say, oh yeah, I know how to do a bench press. And then when we got into it, I realized that their concept of the bench press was you lay on your back, you rack the bar, and you lower it down to your chest, and you push it off. They had no clue as to what the optimization had to be for them to put on 30 more kilos on the bar that they'd never done before. They had no idea. And then I would peel it back and say, would you give me 30 push-ups? And they would look at me. And it turns out they couldn't do 30 push-ups. And I said, well, what the hell are you thinking about doing a bench press? Mm-hmm. You need to get enough athleticism in your body doing 30 push-ups. And then I want to see you do some standing push-ups, where if you stand and create a pendulum over your ankles, fall into the bar, load into a bench press, and then push off and power yourself with an explosive push through to upright standing. When you can start to learn the stiffness, the power breath, and how to unleash power in your body, we're not going near a bench press. That was simply the wrong exercise yet. But anyway, if you want to do it in a spine-sparing way, I've got to know whether they're triggered in extension or flexion or compression or whatever it is. And it may not even be the right exercise yet. If they just simply stood and then did a standing push press off their kitchen counter, that might be much more appropriate for someone who needs some spine sparing. Yeah, well, an ape index has the shortest legs and the longest arms. So mechanically, they are going to be the best deadlifter. And when you measure the great deadlifters, they typically have a very high ape index. But someone with a high ape index is a lousy bench presser because their humeruses are too long in their arms. So now you're asking me for a cue. And do we have someone with a high ape index, or do we have someone who's set up with a short humerus and someone who will be able to position their body for much greater leverage in the bench press? So do you see, you're asking me for a cue for performance and you haven't even given me the person yet. We really can't get there. I mean, I can give you some very, very gross generalizations, like learn how to grip the bar. Mm-hmm. Too many people these days, and I don't know whether it's we all spend too much time on the computer, so we've got computer hands instead of, doing pull-ups on ropes and things like this to build a set of grippers. So they're grip deficient, and not only grip deficient in terms of strength, but grip deficient in terms of know-how. They don't even know how to create grip strength yet. Or they have a soft back and they don't know how to stiffen their back and create a bench in their back to mate with the bench underneath them. Or they'll try a vertical descent on the bar, not realizing that the idea is you start as you've just racked the load and the bar is at full extension, to lower the weight. It's not lowered down, it's lowered down a ramp. You're bringing the bar down more towards your sternum and the lower half of the sternum, for example, to create leverage. Anyway, after that, I need a lot more information before I can give a wise coaching cue. It's very, very specific to the person.
No, that's excellent, because there's a lot of, as you mentioned, with your students, when they go into an exercise, they watch it, get the basic idea of it, and then just sort of replicate it as they think. So to have a much more well explained way of setting up for the bench press is a little bit more effective, and in some ways I kind of want to provoke that type of answer, because I want people to not just approach it as I've seen it on a screen, now I'm going to go and do it on a bench. It's much more effective to, as you've mentioned, gripping the bar, but what is arm length, how does that work, how does shoulder mechanics work, and just to get into a few more of the nuances and the specifics of the exercise. So it would be nice now if we could do a similar thing with the squat, when it comes to wanting to know about the athlete when it comes to a squat. What are kind of some of the things you want to know about anatomically from them before you can set them up, and then maybe just talk about some of the very general gross coaching cues that you might use?
Well, Yeah. I mean, I was just, as you were speaking there, I was thinking of all the tests that I would do on the bench press to see where the person is. And I'm just thinking yet again, I'd ask them, would you just take a kettlebell and rack it up in a bottoms up position?
Mhm.
And I want to see the person push press the kettlebell up in a bottoms up position. And if that kettlebell flops over, I know they've got a lot of work to do before we can have a decent discussion about bench press. And I guess I would do the same thing with a squat. Okay, well, let's talk about the squat. This may surprise you. I'm going to go back one layer further, and I'm going to ask, why is the person doing a squat? A squat is an exercise. An exercise is simply a tool to achieve the goal. Is the squat the best tool to achieve the goal? If you go to the average person and I say, what's your goal? They won't be able to answer that. So how do I even know if they're choosing the best program? So they're lousy performers and they're getting hurt. They don't have a goal. So if you were to say, well, they're doing a squat to be a good rugby player, or they're doing a squat to win their weight class in powerlifting. Well, if they're doing it to be a rugby player, I'm going to say, how much do you push? How often do you push a sled? How often do you push a car back and forth down the parking lot? Because if you're a rugby player, I want to see that kind of athleticism before I see a straight squat. And that will surprise a lot of people. So that's my first thought when someone says, well, how would I set up a squat? Is the squat even the best tool? The next question that enters my mind is, well, now we know the goal and we've decided that some form of squat will be the best risk reward tool that we can pull out of our training toolbox. What kind of squat are we talking about? Are we talking about a front squat, a back squat, a hex bar squat, one of those yoke bar squats? If the person has long arms and they do a front squat, and I see they can't even rest the bar on the top of their chest, they're not set up to do that style of front squat. We'd have to maybe have them crossed-armed in the front. So a front squat, for example, it's all a matter of setting up what we call the line of drive and the thrust line. There's a line that goes up and down because of gravity from the bar downwards. So when a person does a typical back squat and the bar's on their traps on their back, that means they have to move their hips back. So the thrust line, the line from their hip joint to the vertical underneath the bar, is very large, and their knees, as they move their hips back, get pulled towards the thrust line. So the back squat loads up more of the hip and the low back and takes load off the knees. And again, if you have long legs, that's probably a better squat, because if you're a 7-foot tall NBA basketball player and your knees come way ahead of your ankles, that's a lot of knee strain. And that's not how they jump in the NBA. They're much more hip dominant than they are knee dominant. But then we'll take a guy like Brian Carroll, who is a professional squatter, and he tends to be shorter in the femur. And when you examine the thrust line, the hips are tucked in quite tightly underneath that thrust line. And he's very strong in the legs. His legs are proportionately a little bit shorter than a basketball player. So he's much better able to not have to sit back so far. And maybe he'll be doing some auxiliary squats in a front squat style and really build his legs. So do you see how, again, I need to know what the objective is, and we will coach the squat form in the best way possible to achieve two things, and that's almost always enhance performance and enhance the resilience to avoid injury.
And would that be very much the same with regards to the deadlift? So you go through a similar questioning process?
Well, of course. Yeah, of course. I mean, deadlift, gosh, I need to know, why are they doing a deadlift? And if they say, well, I want to strengthen my back, and I'll say, really? We have measured the best deadlifters in the world. I'm not talking through my hat here. We've measured the muscle activation. I've measured the muscle activation in Olympic medalist rowers. I mean, they're a pretty back-centric athlete. You can do a deadlift and you cannot activate the back muscles to 100% neural drive. Think back to the previous question when we talked about the need to enhance neural drive. You'd be wiser to do other exercises if that's what you're doing the deadlift for. But what the deadlift does is it tunes the strength through the body, and you learn how to create strategic stiffness and power development about the mobility joints, which is primarily the hips. More hips if you're longer in the leg, and more knees if you're shorter in the leg. But nonetheless, those are some thoughts there. I would like to see, what's the depth of the deadlift? There are far too many patients coming to me saying, I hurt my back deadlifting. And I said, well, what were you doing? Pulling the bar off the floor? And they said, yes. I said, why? Because they said their trainer told them to. And I said, did the trainer ever examine your hip joints? And they said, no. And I said, that's why you're coming to me as a patient. Thank your trainer. If they only did a hip scour test or a pelvic rock test, they would have determined that that patient or client, former client, they've now lost the client, that client should never have been pulling an Olympic bar from the floor. All they had to do was put the bar up on some blocks and pull off the blocks, and they would have had far more athleticism, and they would have kept them as a client because they didn't get hurt.
Well, it's something that I see a lot in and around gyms. But people, well, I say in and around gyms. When I used to teach the courses, you would get the guys qualifying, and they'd go off into the gym, and I ask them flippantly, what are you training today, and they'll say back, and then they'll go in and do deadlifts, and I just think, why are you doing deadlifts for your back? And it doesn't make a great deal of sense, but for some reason it seems to have taken hold through a certain population, and they really go for it.
If they read The Gift of Injury, they would get some science on some of these questions and how to create programs to make people injury resilient and high performers. I mean, you asked me earlier, why did we write that book? And it keeps coming back to, once we got into it, we decided to put more of a manual component to it. This is the manual for reaching that objective. And it isn't just about, do deadlifts. It's a matter of, is deadlifts appropriate? And if it is, here's how you set up the grip. Here's how you set up the bar height. Here's how you set up the lifter's wedge and create core stiffness and unleash the hips. And here's how you manipulate the thrust line to get even more power development. And
final question, where you sort of get later on in the book, we come to chapter 13, and it's all about what is described as training wisdom. You've mentioned some of it before with regards to training in cycles or training in periods and things like that. But what training wisdom, or could you summarise, what training wisdom would you pass on to athletes that have been through a process like Brian or any other athletes that are in a different sport? Is there any sort of nuggets of information that you would say, try, not necessarily try this, but think about this, question that, focus on this, or whatever it might be?
Yeah, what was going through my mind as you were answering that is, let's say you had a very high-end car mechanic who was actually the guy who built and tuned the car that won the last F1 car race. And what would that person's answer be to how do you tell an average person to tune their car from the guy who just won the last F1 championship? So my answer to this, and again, I don't want to be flippant about it, but be a thinking woman and a thinking man. It's not just a matter of doing an exercise, adding more weight and progressing and beating yourself through it. It's a matter of understanding the scientific laws and processes that govern your body, and then fixing the flaws. Why did that person ever develop back pain in the first place? I mean, that's not normal. Pain isn't normal. So we go back, just as a car mechanic would, to say, well, the computer was off, the timing was off, the tire pressure wasn't right, or whatever it happened to be. And we fix those movement flaws to build training capacity. We honor or recognize the biological processes and why cyclic rest is mandatory. That's when the adaptation takes place. Then it's time to start adding a little bit more drive and horsepower, and we would get into the considerations of the science that governs strength. And so I know that's at the generic level, but I have to leave it at that level. You know, it's the assessment and the understanding of the person's goals, their injury history, who their parents were, their age, all of these things. I mean, how I train, I'm in my 60s now. I mean, I have to train differently than I did in my 40s and in my 20s. So, you know, we need to consider all of these things. But isn't that what creates the great trainers? It's the ones who have the knowledge and understand that person who is in front of them and guide them to the best of their ability.